Hello everybody, I want to talk about palliative and end of life care. This is going to be based on chapter 16 of Mandrake Manual of Health and Aging. I changed the last two parts at the beginning, but the rest is going to be just be able to follow along. The first thing I want to ask you is, where are you planning to spend your retirement or your golden age? For us, or for most of us, it's going to be in a nice place, traveling and spending time with the people that we love. However, this is not realistic because of the world we live on. 2 out of 3 Americans are going to end up with two or more chronic diseases, which take us to the uh, challenge of learning how to live our best or fullest potential with these diseases. So this is where palliative care and hospitalization care comes from. So on this case, we are not going to work on extending our life to make it more comfortable, more quality kind of a time that we have to spend with our family. You need to be aware of the settings where you're going to be, the symptoms that you're going to have, and how do you want to address them in the most correct form. And last, we're going to check for peace and resolution. So this is basically going to tell us how to address uh, the stuff of our life after we're no longer here, how it might affect the people that we love, and how to be ready for it. Our first topic is going to be signs of approaching death. This is the 5 more common signs of someone is about to die, and it is changes of level of alertness, absence of urination, decrease in eating or drinking, changes of skin, and changing on breathing patterns. The first one is going to be alertness. As you might find out, as the person ages, the type of alertness are going to be decreasing. You're going to see it more lethargic. So you want to be aware of their surroundings. You want to be aware of where are they located, and there is no possible risk for them. You're also going to see a decrease on eating and drinking. This is very common on people because they're no longer having a high caloric demand, so they're going to reduce the amount of food that they're continuously eating. However, you are going to see them drinking enough water usually. Absence of urination. This is a major thing when someone is about to die. It usually let you know if someone is about to die within days to hours. Change of skin. You're going to see they're mostly on the extremities. They're going to be bluish, pale, cold. So be aware of that. Breathing patterns. You're going to see periods in which they just completely stop breathing and then they just come back again to breathing, as well as have weird patterns or irregular patterns in which it was like rapid and shallow breathing. Always you want to have in mind the type of treatment you're gonna have with this patient. You want to be bold. You want to set goals. And you want to keep it realistic for uh, the patient. So reducing suffering, which is not necessarily suffering itself, but to learning to live with the symptoms. So the first one we're gonna see is pain. This one is particularly important because it tends to affect not only our physical being but our emotional being. From don't let us sleep at night to don't be able to enjoy our favorite activities. There's multiple ways to manage this. There's massage, there's cold, there's heat, chiropractic care. However, the standard in hospitals is gonna be give them opioids, unfortunately. On those you want to keep an eye on because you usually have side symptoms and constipation, nausea, and confusion, which give you a red flag, a false red flag. Also, you want to be aware of the drugs that they're taking, that they take them on time if they jump into this level, as well as the addiction component of the opioids. Shortness of breath and coughing, because most of the people are going to have problems breathing, and anemia. Their breathing pattern is going to change dramatically in some cases, and you're going to see a lot of coughing, a lot of like kind of asthmatic attacks, but not really. Just see them firstly trying to breathe. The best approach on this way is going to be make them breathe into a cold air in an uncrowded place. use a fan or something that blows air on their faces. Calming distractions. Again, just be there, touch them, let them know that everything's gonna be fine, that they're gonna be able to recover. There's nasal prongs and other opioids. Again, you need to be aware of the side symptoms. Nausea and vomiting. This is usually happens because of cancer medications or other type of medications that involves the gastrointestinal tract. This can cause a lot of pain, and the usual treatment that we're gonna give them is acupuncture as well as something to calm their stomach down. Um, they're gonna have a lot of loss of appetite. This is gonna be something that you need to be aware of why it's happening, because most of the time it's gonna be because they have problems in their mouths. They have difficulty chewing, dry mouth, soreness, infections, or something going on in their mouth. Um, Constipation, sorry, mouth problems. A typical sign of anti-cancer drugs is going to be ulcers inside of the mouth. That'll bring you fungal infections and other complications that again usually affects the lifespan and the quality of life of the patient. Then we have diarrhea. That is not really common. However, it can bring irritation in the colon and in the anus, so look for a way to treat it. Constipation, this one is very common actually, and is usually because the patients are inactive or they don't move along, as well as the fiber on their diet, so you make sure you watch out the hydration, the diet, and that they move. Pressure soreness, this happens because the patients that are on bed, unfortunately, they don't move their position, so they're on the same pressure points at the same time, so the skin start breaking and they have this sores. The best approach that I can find I was able to find was this inflatable mattresses that changes position, so the pressure is not always on the same point. Now we have itching. This is very common on patients that have liver and kidney problems, as well as patients that doesn't have a lot of hydration, dermatitis, or have poor hygiene. So make sure you keep an eye on all the patients that doesn't like to drink water or they have kidney problems in order to avoid problems on the skin. Fatigue. This is extremely common again on older patients. The best approach that the book is gonna let us know or talk about is gonna be just let them rest. Let them rest as long as they need to. Anxiety. For anxiety, it's important that the family members are aware of the anxiety that the patient is suffering and to help them have counseling. That can be mental counseling as well as religious counseling. Depression. Depression is different. It's one of the major problems that we're having right now with elderly patients. So on this one, you do definitely want to have them on their mental counseling and have them a little more like social support and community support in order to help them out and feel better. So retaining control over decisions. You're gonna have the advanced directives. That is giving will. That is something that you're gonna make the patient have in order whenever they die, they have a clear instructions or where they're gonna be, all their assets are gonna be located, as well as the assisted suicide programs. They're not actually legal in the States yet. The only place where they're legal right now is Oregon, which is gonna basically help the patient to take care of, to finish their life in the case they are on very radical and aggressive treatments. And thank you very much.